Tirzepatide Mounjaro kwikpen is a once-weekly treatment for adults with type 2 diabetes, or obesity, or overweight, and a weight-related complication. In this video, you'll learn how to use the multi-dose Tirzepatide Mounjaro kwikpen. It is important that you learn how to properly store and handle the Tirzepatide Mounjaro kwikpen. Please read the instructions for use that come with your kwikpen. Make sure to review the front and back of the Tirzepatide Mounjaro kwikpen carton for important information and safety instructions for this medicine. You should always use the medicine exactly as your doctor or pharmacist has told you. Please read the package insert and instructions for use before using the Tirzepatide Mounjaro kwikpen and each time you get your refill. The Tirzepatide Mounjaro kwikpen is a multi-use pen that contains 4 once-weekly doses. Each pen is for one patient only and should not be used by anyone other than you, even if the needle is changed. The Tirzepatide Mounjaro kwikpen injects the medicine subcutaneously, or in other words, under the skin. Ready to learn how to use Tirzepatide Mounjaro kwikpen? Let's begin with preparing for your once-weekly injection. You'll need these supplies for your once-weekly injection. 1 Tirzepatide Mounjaro kwikpen, 1 kwikpen compatible needle, 1 alcohol swab, gauze, 1 puncture-resistant container for throwing away used needles. Remove the carton from the refrigerator. Remove the kwikpen from the carton. We will now review the steps to inject your dose of Tirzepatide Mounjaro kwikpen. First, get ready for your injection by washing your hands with soap and water. Pull the cap straight off and inspect the kwikpen and label. Check the kwikpen label to make sure you have the right medicine and dose and that it has not expired. Make sure the medicine is colorless to slightly yellow. Do not use the medicine if it has been frozen, is cloudy, or has particles in it. Wipe the red inner seal with an alcohol swab. Select a new pen needle. Always use a new pen needle for each injection to help prevent infections and blocked needles. Pull off the paper tab from the outer needle shield. Push the capped pen needle straight onto the pen and twist the pen needle on until it's tight. Pull off the outer needle shield and keep it. This will be reused. Pull off the inner needle shield. Put it in your household trash. Next, slowly turn the dose knob until you hear 2 clicks and the extended line is shown in the dose window. This is the priming position. It can be corrected by turning the dose knob in either direction until the prime position lines up to the dose indicator. Hold your kwikpen with the needle pointing up. Tap the cartridge holder gently to collect air bubbles at the top. Next, you'll need to release some medicine into the air by pushing the dose knob in until it stops. After the dose knob stops, begin slowly, counting to 5. While holding the dose knob, the 0 icon must be shown in the dose window. Do not inject into your body. Priming ensures that air is removed from the cartridge. The pen is successfully primed if a drop of medicine comes out of the tip of the pen needle. This means the pen is working correctly. If you do not see medicine, repeat this step no more than 2 additional times. If you still do not see medicine, change the pen needle and repeat this step no more than 1 additional time. If, after the 4 attempts, medicine is still not seen, contact your local Zuellig Pharma office listed in the patient information leaflet. Now choose your injection site. You or another person can inject Tirzepatide Mounjaro kwikpen in your stomach or thighs, or you can have another person give you the injection in the back of your upper arm. Change or rotate your injection site each week. You may use the same area of your body, but be sure to choose a different injection site in that area. Now turn the dose knob all the way until it stops, and the dose window displays the number 1. This position is equal to a full dose. Then, insert the needle into your skin. Inject the medicine by pushing the dose knob. Press the dose knob until it stops, and only then do you start counting slowly to 5 while pushing down on the dose knob. You'll know your injection is complete when you see the dose window. Display the number 0. Pull the needle out of your skin. A drop of medicine on the needle tip is normal. It will not affect your dose. Confirm the 0 icon is in the window. If you see the 0 icon, then you have received the full dose. If you do not see the 0 icon in the dose window, insert the needle back into your skin and finish your injection. Do not redial the dose. If you see blood after you pull the needle out of your skin, lightly press the injection site with gauze or a cotton ball. Do not rub the injection site. Carefully replace the outer needle shield. Then unscrew the capped needle. Do not store the pen with the needle attached to prevent leaking, blocking of the needle, and air from entering the pen. Throw away your used needle immediately after each injection into your puncture-resistant container. If you do not have a puncture-resistant container, you may use a household container that is made of a heavy-duty plastic fit with a puncture-resistant lid that can be closed tightly without needles being able to come out, upright and stable during use, leak-resistant and properly labeled to warn of hazardous waste inside the container. Do not recycle your used puncture-resistant container. Ask your healthcare provider or follow the community guidelines in your area on how to properly dispose of your puncture-resistant container. Replace the pen cap. Do not store the pen without the pen cap attached. You may store your used pen at room temperature up to 30 degrees Celsius after your injection. Keep away from heat. There will be medicine left in the pen after the 4 weekly doses have been administered. Attempting to inject any leftover medicine could result in an incomplete dose. Throw away the pen 30 days after first use, even though the pen has medicine left in it. Tirzepatide Mounjaro kwikpen should not be used past its 30-day in use. If you have any questions or concerns about administering Tirzepatide Mounjaro kwikpen, please contact your healthcare provider or Zuellig Pharma.